Good afternoon. Thanks, Bob Marley and the outreach team for inviting me to speak on this topic. It's something that I think is becoming a lot more popular in the media in terms of repetitive concussions, but also you yourselves as professionals have been experiencing athletes with history of concussion and multiple concussions, particularly if they've played since they were really young. So I wanted to address this topic today with you. And disclosure is not necessarily relevant to this presentation, but nevertheless, in terms of financial and/or relationship disclosures, funding for the Moody Endowment, R21 NIH funding that we're wrapping up some of our studies with, USA Cheer Medical Advisory Committee, and the Sports Neuropsych Society Executive Board. So definition of sports-related concussion has certainly evolved around the years, and particularly with the most recent concussion in sport update in Berlin, the information became much more complex and that the features were also indicated. So as you know, certainly a direct blow to the head, face, or neck or elsewhere of the body, and any kind of impulsive force can be transmitted to the head, causing a concussion. Generally, another feature is a rapid onset of symptoms, although sometimes concussion symptoms evolve over minutes to hours. It results in functional changes in the brain with no abnormality seen on neuroimaging studies, may or may not involve a loss of consciousness, and certainly has a sequential course, although in some cases may be prolonged. The recent statement also went on to add that this diagnosis cannot be made in conjunction with any other types of operating diagnoses, such as like there being a vestibular disorder that is also related to medication someone can be on. So certainly there's this qualifier that better understands that concussions can certainly have overlapping symptomatology with other syndromes. Concussion diagnosis certainly can be made based on one symptom or multiple symptoms, and they are kind of broken down into several characters, and this has been studied too over time. Particularly athletes can manifest clusters of symptoms. So somatic symptoms like headaches, dizziness, visual changes, cognitive being more the concentration issues, emotional symptomatology. Certainly the physical signs can be amnesia, neurological types of signs and symptoms, balance instability, and the cognitive impairment and the sleep-wake disturbance often comes later on as the condition persists. I wanted to talk about subconcussive blows because this is certainly something that's become a lot more common in the literature. And just a kind of a silly story, I guess. I have a 22-month-old now and an 8-year-old. And so very frequently does the 22-month-old like to hit the 8-year-old in the head. And so she knows what I do for a living. And she came to me one day, she's like, I think I've gotten like 5 concussions today. And I said, no, 5 subconcussive blows, head impacts. So certainly we need to also change the way that we describe what these head impacts are. A subconcussive blow is defined as brain trauma, but there's not necessarily any type of acute symptomatology that presents with the situation. There's no suspected concussion or apparent signs upon evaluation. However, these repetitive subconcussive blows that we're learning about and kind of hearing more about, unfortunately through the media, does maybe perhaps evolve over time and result more in cognitive dysfunction. And it's been linked to CTE, although the exact number of head impacts has not yet been determined. And frankly, it's probably based more on a threshold of an individual than everyone kind of manifesting the same number of head blows. The brain white matter changes in the brain have also been found in studying athletes that are both in contact and non-contact sports. So again, even though the athlete who is playing soccer or football may not manifest any symptoms or show any signs, certainly when their brains are examined against a non-contact athlete, there has been some apparent changes. So the ongoing debate here is there a disturbance in the brain? Is it transient in athletes with a history of repetitive head trauma? So in the study that I have the funding for, we did find that in athletes that were cleared to play at 1 month post-concussion that met all the current clinical criteria, that they did show changes in their brain in terms of functional capability on fMRI and DTI, which is the white matter tracts that we mentioned in the previous slide, did show those changes when compared to control athletes, orthopedic athletes that were not coming in for a concussion at that moment. So now what we don't know from that study and what we would try to get additional funding for is how long does it take for that particular change to maybe complete itself, or is it reversible, is it not? And that's what we need to be able to study further. The idea is, though, that someone, if they suffer a repeat concussion within 10 days, that's certainly supported that the pathophysiological vulnerability of someone is such that within 10 days it's concerning for them to return back perhaps to sport. So that becomes a bit of a concern as well when we think about particularly guidelines that are aimed at, you could start your return to play protocol within 24 hours, like the UIL's guidelines, that really, even though they're meeting that clinical recovery period based on the items that we give them in terms of outcome measures, still they're in that vulnerability window perhaps at being returned back within 1 week of their concussive injury. So further concussion research is certainly needed to study what is the long-term effects of a single concussion versus those that have had repetitive concussions. So for example, most of the problematic things that we hear in the media that are played out, or the studies that have been done, have been focused on repetitive concussions or history of repetitive concussions. But what about those individuals who never yet, or perhaps have a prolonged recovery after one single event? So we don't know what makes one more vulnerable than the next. We have some ideas, but that still hasn't been consensus in terms of an identifiable factor. So many of the studies, though, have mixed results, that there are some long-term consequences of some athletes versus others who do not demonstrate any kinds of consequences. And basically, the idea has been that a lot of the studies have been methodologically very different. They've had different sample sizes, and we tend to base the repetitive concussions on how many concussions have you had. It's based on self-report. So we're not necessarily studying someone longitudinally. We're studying the person at the time of that most recent injury. So let's say we're studying them after their second concussion and they're telling us they've had one before. The studies have focused mostly on cognition and rarely on the physical components, such as maybe migraine headaches, mood-related changes. So mainly the literature is focused on what are the cognitive consequences. We don't necessarily hear so much about the person that has very debilitating headaches that go on for years in the absence of any other symptomatology. So the vulnerability here, according to Guskowitz, is that when players have a history of previous concussion, they're more likely to have a future concussion. That's pretty well established. The idea, though, again, is that for the subsequent concussions, the ones that occur after another one, that they last more than 7 days. So where the first concussion may have been 1 to 2 or 3 days of symptoms, the subsequent ones will generally have a longer course of recovery or more days to be symptomatic. And that's generally the case whenever I interview people about their concussion history. They will say, well, it seems like the first one wasn't as bad. It was maybe only a couple of days of symptoms, and now at the second and third, we're seeing a longer course. Sometimes, though, I feel that might just be a product of the recall from previous events. If you've ever been in a situation where at the time it was dramatic and difficult and you remember all the hardship, and then later a few years go by and that's actually more protective, and you're like, that wasn't really nearly that bad. So it might be, again, our recollection of the situation as well. Certainly the subsequent concussions often, and you would probably agree with this anecdotally in the athletes that you work with, that generally the severity of symptoms are more severe as well in subsequent concussions. What are the effects here? Athletes with a history of multiple concussions do report more symptoms as well. So let's say the following season we go to baseline test them again, or they several years down the road we go to test them in college when they enter to do their baseline testing. And traditionally they will report more symptoms just on their baseline exam when compared to athletes that don't have that history. And in athletes, according to Iverson, that have 3 or more concussions, we're performing more poorly on verbal memory tests. So we feel like the evidence is there that there is this difficulty, and it tends to appear most on auditory verbal memory, wordless memory, or recall for story information. And then according to another study in 2013, retired NFL players with a history of multiple concussions, and I believe the statistic was 3 times more likely to suffer from depression than those of a history of concussion. So one thing to consider too is the athletes with multiple concussions, were they also forced to retire early, or did they have a problematic recovery that also could be leading to their depression? So the difficulty here, and I think you would all agree with this, is what is that symptom-free period of time that someone needs to go through or to achieve before they're really ready to return to play? And that's certainly been very controversial. It varies against guidelines. So for example, a lot of the guidelines used to put a mark of 24 to 48 hours. Some guidelines will say 7 days. It's certainly based on expert consensus and rarely based on scientific methods. So none of this is really scientifically based in terms of the duration of time out of play. And then the age consideration. Should we be much more conservative with younger pre-adolescents than older adolescents and young adults? That still is controversial as well and not been established through research. There is more research now, and we certainly do subscribe to it as well when it comes to getting patients more active in the initial phases of their injury, whereas we used to wait before until someone was symptom-free. However, I would really, really stress that that is an individual situation and should be really done with a collective group of professionals versus just saying, okay, let's go ahead and get you more active the next day and start exercising you when their symptoms are really significant. That can actually prolong recovery, and I'm still a firm believer in that it's a very individual process in which they need to be fairly asymptomatic. So the variability, again, is uncertain. So if someone has 1 concussion, is their variability rather low versus if they've now had 2 or 3, are they getting concussed more easily? And I think that's been demonstrated as well, and we've all seen that maybe in our practices, that certainly it seems that when an athlete's had multiple concussions, it can take less force to concuss them and less force to make the symptoms more predominant. The idea, again, to reiterate, is the 7 to 10 day window of vulnerability is very important post-injury. So return to play considerations. How do you manage this athlete? I don't think I have the exact answer for you today, so I don't think any of you all have the exact answer. If you do, please come up and share that with me and everyone else. But I think it's important to walk away with some tips in that know your athlete, know their history. In big schools, you may not have the luxury of knowing their exact history. Maybe they weren't forthright about it. We've had a lot of that happening as well, where they're not disclosing certain information. But get to know your athletes about their concussions. If you have a specific, maybe they report things on their medical history form, but maybe you want to have a specific form now for concussions and just ask a bit more detail. That wouldn't be a harmful thing. Elongated return to play. We often subscribe to, okay, if someone's had repeat concussions in a season, maybe we need to spend more days at each phase of the protocol. And I tend to utilize that type of technique, and I think it's more successful. It creates a bit more confidence in folks. Reassess the athlete's reporting behavior. Are they going to be truthful to you? Is there something you can do or something that they're doing with their playing style that can be adjusted, that you can work with or work with the coaches on? I think that's an easy thing to also explore. What's their position? All those things go into the decision making here. And it should really be multidisciplinary. So if we're going to return an athlete with a problematic history, it's really very helpful for me to go back to you as the athletic trainer or the physician or whoever's involved in their training and so forth and their play to say, do you think they can be truthful with us? What do you think? I mean, what are you seeing? And I think that discussion is also could be a good area between what happens out with the return to play protocol here. The $1 million question, of course, is the retirement challenges. How many is too many? And Cantu in 2011 recommended, and here's kind of where the basis of some of this comes from, is that if there's a concussion process that happens 3 concussions in one season, 2 for adolescents, then there should be a termination of playing for the rest of the season, and then a 3-month waiting period. Again, not based on any scientific validity, just mainly on expert consensus, really Cantu. So what about other things, like someone that has numerous concussions, they fill out the form, you know as their provider they've had numerous concussions, yet they're symptom-free, they pass all your testing, you really are confident they're fine. What's the liability or what's the future hold for them? And that's really tough, and I think those are the hardest cases for me as a provider, and then I have to tell someone, gosh, you've had a lot of concussions, I'm worried about your future, when in the moment and at that current time they're actually doing quite well. So each program also handles concussions differently. I work with several different universities, and there's some who have a pretty strict policy about you've had 1 or 2 concussions in the same, 2 concussions or more in the same season, you can't return to play really within the same season for sure. And then they start thinking about, do we return to play within the program? So that's also becoming more common. Certainly individual characteristics are the most important here and should be stressed, such as less biomechanical force. We've talked about that. Is it, are they now walking by and they're hitting their head on the cabinet, as many of us have probably done, and we say a few choice words, and then now it's becoming they're concussed and they're symptomatic for several days. Is there potential for mood issues or people saying they're different in their behavior and their character? We also need to consider financial consequences, career. Certainly you're going to make a different decision perhaps for someone who has a career potential. I mean, those things all go into the equation versus someone who's just doing this for fun and don't see themselves playing beyond a certain point. What are the health issues? When we talk about kids and we say, let's terminate you from the sport because it's problematic and you're having too many concussions, do we ignore it then? And we need to really probably think about what can we then return them to, because we don't want them to not have any physical activity, but for good brain health and good physical fitness, we need to talk about other types of sports they may play or other activities. What about the legal challenge? Certainly I've been a lot more mindful of this, and particularly in my profession, we're getting pulled in all the time as expert witnesses and getting asked based on our ability to consume the literature and publish what we think about these things futuristically. And I would just say that it's much better when you have a team of people making a collective decision, and that includes everyone from the athlete, the coach, the parent, the provider, athletic trainer, everyone involved. It's a much better decision. So I want to go through a case study. Some of you may have saw some of the graphics from this particular case study, but I think it's a good illustration of multiple concussions in a particular in a short amount of time. This is a collegiate female soccer player. She's 21 years old. She's right-handed. Her medical and psychosocial history is generally unremarkable and non-contributory in terms of her concussion issue. She has no prior concussion. She played youth and high school soccer. She has no academic difficulties. She's an above average student. She has no psych history that was reported. Her injury information, and she did complete the return to play protocol after each injury, and I was involved in that decision making along with the team physician and the athletic trainer. In July of 2015, she has a car accident. She goes through all the proper return to play protocol stuff. I'm going to talk about that in subsequent slides. She has her second one a month later, and it's soccer sport related, and she has another one 2 months later, then it's soccer sport related. So essentially 3 concussions in 3 months. And a little bit more specifics here about the first concussion in the motor vehicle accident. She struck her head on the steering wheel. She was belted. There was no loss of consciousness. She did have amnesia. She presented to the athletic training staff 1 day after the injury with post-concussion symptoms, and she demonstrated deficits when they did the impact test with her. 2 to 3 days post-injury, the athlete reported resolution of those symptoms, and then she was cleared to initiate the return to play protocol and completed it without any difficulty, and didn't have any or did not report to us when asked any lingering symptoms or any noticeable complications. So impact testing, we did see one deficit early on, and we talked about that when I said there's deficits. It was in the verbal memory arena, but by the time that we did test her 7 days later, approximately from the first evaluation, and she's tested initially for 1 day post-injury, you can see that all of her scores had returned to baseline, if not better, which is what we hope to see. Then the second event that is soccer related, she's attempting a header. This is all too common. An opposing player strikes her in the chin. She falls to the ground and strikes her head again, so we have 2 head impacts. She has a brief loss of consciousness with this one, and it's fairly days. Remember, this is approximately 1 month post-injury or prior concussion. Impact revealed deficit this time in reaction time, so not all concussions are alike and can certainly manifest different deficits. On the 13th of September, her impact resolves back to baseline. She starts the return to play protocol. We go ahead and talk about this elongated protocol, 2 to 3 days at each phase, and then she's out of play for 6 weeks at that point, given her trajectory. So this is the second injury here. This will be second injury, first post-injury, test 1 and 2. So again, we talk about that and how her symptoms, she is symptomatic after the injury and her deficit reaction time this time instead of verbal memory. So the third one, which is again soccer related, she's struck in the back of the head during a soccer drill. There's no loss of consciousness. There is some amnesia. She has an immediate onset of symptoms, and then per this university's policy, she's not returned to play in the same season given their rule of multiple injuries in one season. She has persistent symptoms, but they certainly improve. And then interestingly, we got her back to activity. She was doing pretty well. We weren't hearing anything necessarily as we were checking back in, which I'd always encourage you to do. And then in early February, I get a phone call from the athletic trainer, and he says, gosh, there's some weird things going on. She's talking about like some maybe kind of tremors. She's talking about muscle twitching. She's having hair loss. She's anxious, depressed, and she's now having an academic decline. So it was really interesting because we did see this period of improvement. So there may also be with, and this is something that my colleagues also talk about when we have different discussions or at meetings, is that, you know, acutely there may be this sort of improvement period, but then as we, for lack of a better phrase, kind of marinate on the situation and things persist, perhaps symptoms do become more noticeable. And, you know, it could be also that she's out of play at this point, so therefore some of the psychological components are setting in. See on this particular impact test now, again, third injury, and we see now all 4 cognitive domains depressed when compared to baseline, but we do see this recovery process within about 2 to 3 weeks afterward where everything does resolve in terms of impact. And then whenever I had the athletic trainer test again throughout the course here, things seem to normalize again on impact. So we did send her to a neurologist, and an EEG was recommended in blood work. Those were normal. And then, you know, it's typical to do this MRI evaluation in some of these persistent cases, but we do have the technology now where we can do a 3T MRI, which is a bit more intensive, and then the DTI, which I mentioned earlier, looking more at white matter tracts. And we were able to conduct that type of imaging with the athlete. We did recommend medications to help with her headaches and mood, and then we diagnosed her with post-concussion syndrome. And we did allow her to participate in controlled exercise, which if you're familiar now with the LEDI protocol, that is where we do monitor heart rate. We adjust the amount of cardiac activity based on the ability to do so without an exacerbation of symptoms. So she was on that protocol with us. And then we certainly did talk about or advise retirement from sport. So I am not pretending to be a neuroradiologist, nor do I interpret them. But it doesn't take much to really see there's something really going on there in the left frontal lobe where the particular area up there in the tracts and the fiber is completely missing. So now, when did this process occur is kind of the million-dollar question. Did it happen early on? Is it because of multiple head impacts playing soccer? Is it the first one? Is it the second or third or combination? You know, the unfortunate thing is we never got to know when that actually happened, and we'd love to bring her back to get re-imaging. I think we're working on that because we'd like to see, is there any change? Does it get worse? Does it improve? I mean, nobody really knows these things. What does it mean for her future vulnerability? But the fact that we're seeing changes in a whole section of the frontal area missing in terms of fibrous material and tissue, white matter material is concerning, particularly when white matter deals with memory, functioning, and attention concentration. So in the evaluation that I conducted with her, she's still having headaches, mood issues. We did go ahead and suggest the academic adjustments. She was tolerating light workouts, so not particularly more symptomatic with exercise. We worked on psychosocial strategies to help her with anxiety, to reduce those things. She wasn't really interested in taking medications. We did perform paper pencil testing. So it used to be that we do the impact testing, but now we really kind of use with more persistent types of symptoms and cases such as this, we do a more comprehensive assessment. And on paper pencil testing, keep in mind she was normalizing on impact, potentially could be a practice effect. She's taking it several times. We do find this low average performance on memory measures. And so again, that's kind of more focused on where we're seeing the functional changes on the DTI. And then of course, mild to moderate depression and anxiety. So we continue with the academic support. We continue to work with her on things that she can do to improve these daily cognitive challenges. We do encourage, even though she was a bit adamant to do so, neurostimulant medication. She did agree eventually, and that did really help her with alertness and mental efficiency. We monitored her emotional state, especially with an athlete. We're talking about retirement. We're talking about still doesn't feel well, and then certainly has, again, the left frontal lobe is also very prevalent in depression and mood issues. We have to really monitor her, talk about non-contact, and then reevaluation. So like I said, I haven't had this follow-up opportunity with her yet. We really would like to get her back in and see kind of what the longitudinal effect is. Now, does everyone with multiple concussions look like this? Probably not, maybe not, we don't know for sure. So I am just showing you an isolated case, but I think it's pretty compelling of some of the situations that do happen in one season, and particularly where we need to go and what can happen to the individual as things persist. So with that, it's the end of my presentation. Did you have any questions that I could address with respect to this topic or anything in general? And this is we do like to play with brains in our spare time. I think you guys have seen some of these pictures before, but each year we try to do an event with children. We talk about brain health and brain safety, and Bub always mans the egg drop station, so we talk about helmet safety, and he got to wear a fun hat, so we had good times. Any questions? All right, thank you. Oh, I'm sorry, I didn't see.
Are they still talking about extending the recovery time to the younger kids, like in middle school concussion? Should take longer, is that what we're saying?
The middle school kids should take longer?
Right, the younger they are.
You mean in terms of your protocol with them? Yeah, so certainly in the last consensus statement, that was a big hallmark of the group and what they want to do further with further testing and further assessment and research is that, yes, there probably is a separate protocol for them, and they may not show these bad changes now, but given that they're still in developmental phases, they can manifest problems later. So I think you wouldn't harm them by being as conservative as you can with them. But it's hard to, again, put a day on that. Like, do you spend 1 or 2 with them versus an older adolescent? We can't answer that question. I tend to err on the side of caution and try to elongate that as much as I can.